topic on the physical modalities. So these are all the different modalities that we make use of in rehab in treating our patients who come in for therapy. No? So when you say physical modalities, it is a part of the therapeutic program, or it is a comprehensive approach in rehab medicine. So physical modalities are some of the most commonly used therapeutic tools, no? And they will be used here, such as the use of heat, cold, water, the use of sound, the use of electricity in the treatment of disease or injury. So to be able to use them properly, or for you to be able to know when to refer these clients to us for these different modalities, you have to have an idea on what are these physical modalities, what are their uses, what would be their advantages, disadvantages, what would be the indications and the contraindications, so that you will know when to refer the clients, no? So you need to understand their basic physiological effects on human tissues. So first we start with the use of therapeutic heat, no? So therapeutic heat can be given to patient for therapy either as a superficial form of heat or a deep heating modality. So superficial, ibig sabihin, it will only affect a superficial layer of the body, and deep would be including deeper structures such as your muscles and your tendons. So first we have the superficial. They come in the following forms. It could be with the use of the hot wet packs. These are commercially available. They are termed as the hydrocollator pack, the hot water bottles, or the hot water bags. No? You've probably seen your grandparents putting in hot water inside a bottle and then using it as hot compress whenever they have body pains or muscle pains. No? So now, instead of using the water bottles, which may suddenly break because of a very high temperature, they made it commercially available in the form of your hot wet packs or your hydrocollator packs. Next, you also have the different electric heating pads. You have the paraffin baths, or it could be an agitated hot water that is placed in a whirlpool, or an infrared ray, and even the UV ray. So these are all examples of superficial heating modalities. So these are the commercially available hydrocollator packs. You have your electric heating pads. You have your paraffin bath. You have your infrared ray lamp, the UV ray. And the second one, you have the deep heating modalities, or deep heating agents, that comes in the form of your shortwave diathermies, either a microwave or ultrasound. So these are examples of your shortwave diathermies. This is an illustration. So when do you use heat? No? They usually prescribe the heat taking into consideration the physiologic effects of heat on certain body structures. No? So of course, because it is heat, it is hot, it results in increase in temperature. No? There is increase in temperature to the body part that has been exposed to the heating modalities. And indirectly, it has an analgesia effect. No? Sometimes a tolerable form of heat suits your body aches and pains, no? Kaya 'di ba nag-hot compress tayo, no? Because of its effect on analgesia, and a vague side effect would be sedation. Vague because they cannot actually explain how it brings about sedation, no? Kasi 'di ba minsan pag mainit hindi tayo makatulog, no? But when you are in an air-conditioned room, nakakaantok naman. But there is a certain level of temperature na heat pa rin siya, but it results to sedation. No? And of course, the increase in temperature will also result to increase in metabolism. So remember, di ba, yung taba, kapag prinito mo, di ba natutunaw siya? So because of increased metabolism. Kaya yung iba, 'di ba, when you are exercising or nagda-diet, you can see people in the gym o kaya sa sa oval when they run, naka-thermal suit pa sila, no? Because they want to burn the fat as a result of an increase in metabolism from exposure to a hot temperature. And then increased temperature will also result to arteriolar dilatation, which will now result to an increase in capillary flow and increase in capillary pressure. That is why in certain cases of presence of edema or in the presence of bleeding tendencies, you don't prescribe heat or increased temperature because it will increase bleeding tendencies. No? The increase in capillary flow will also increase the clearing of metabolism and heat. It will increase the supply of oxygen or nutrients or antibodies and even leukocytes. The increase in capillary pressure may also result to edema. So these are all physiologic effects of heat, either good or bad, because of course edema would not be good. Other effects, as I mentioned, we have analgesia, but the mechanism underlying it is not well understood. It may be related to a reduction in the thermal gradient through the skin. It also has a muscle relaxation effect, where the relaxing effect on the muscle tone, either in a muscle spasm or spasticity. So in the presence of an increased muscle tone or spasticity, you can order or prescribe heating modalities which will produce a relaxing effect on these structures. It also has a reflex vasodilatation in an area that is remote from that is being heated. So, for example, you put a heating modality over the lower back, you can have a reflex vasodilatation of vascular structures in the lower extremity. So area that is remote from the structure that is being heated. Okay, as I mentioned, the sedative effect is poorly understood. There is increased capillary flow, which may result to the opening of more capillaries and shunts, resulting to erythema and engorgement. And other studies have shown that there is a blood flow in the arm in response to exposure to a hot water bath. Okay, so in a bath temperature at 26 degrees Celsius, it has shown a blood flow of about 5 cc per minute per 100 cc. No? At this temperature, you have this corresponding increase in blood flow. That is why it is also contraindicated in clients who come with bleeding tendencies or problems in coagulation of the blood. So it also results to increase in capillary pressure, wherein the plasma protein now escapes into the interstitial space, which may lead to fluid retention. So heating should not be prescribed in the first 24 to 48 hours after an injury, but rather use or prescribe the cold packs. So other metabolic effects of it, so what were previously mentioned were the physiologic effects. It also has metabolic effects, such as an increase in cellular metabolism. The metabolism increases by 10% for each 1 degree Celsius rise of temperature. It will also result to increase in phagocytosis, which is optimum at 40 degrees Celsius. No? So increased tissue temperature exceeding 42 to 45 degrees causes cell damage and death. The therapeutic heating is below this level. No? Kaya sabi natin increased phagocytosis, isn't it that you also make use of boiling as a form of sterilization? And it is because at increased temperature, there is increased phagocytosis. So methods of application of heat, again, it could be superficial and a deep heating modality. So the general indications for superficial thermotherapy would be in the presence of joint stiffness, there is musculoskeletal pain, in the presence of muscle spasm, as preparation for electrical stimulation and therapeutic massage, preparation for passive and active exercises, particularly if there is joint stiffness, so that after heating, there would be greater range when you try to stretch the joint. It is also prescribed during subacute and chronic traumatic and inflammatory conditions. So if it has indication, there are also general contraindications. Now, these are the conditions wherein you have to be cautious of prescribing the heating modalities. No? So in the presence of acute and subacute traumatic and inflammatory conditions, because it may promote or increase the inflammation to joints. In the presence of decreased circulation, decreased sensation, in the presence of a deep venous thrombosis, for people with impaired cognitive function, because if the patient will not be able to tell you that the superficial heat is actually very hot, it may induce burning or blister formation in the area that was exposed to the superficial heat. In the presence of malignant tumors, why? Because as I mentioned, the increase in temperature will also increase in blood flow. So you will induce the malignant tumors to metastasize in other parts of the body. So, and also it will increase the tendency towards hemorrhage or edema because of the increase in the capillary pressure. It is also not prescribed in the very young and the very old patients with the same reason that they may not be able to tell the therapist if the heating modality is way too hot and may cause burning of the body structures exposed to the heat. So we will discuss the different types of superficial thermotherapy or heating modalities. So first we have the hydrocollator packs, most practical, and it is the most commonly used. It is commercially available. It contains a silica gel which is hydroscopic. So when you say hydroscopic, it is water loving. It absorbs water. So it absorbs the hot water which heats up the silica gel, providing the increase in temperature. So it is applied at about 46 degrees Celsius. So this is actually very hot. That is why you have to coat the hydrocollator packs with several layers of towel before you apply it or expose the area to be heated. And ask the patient if the temperature is tolerable or not. No? If it is too hot, you can put several layers of towel. But if it is already, of course, it will cool down. No? We cannot maintain the same temperature throughout. So once the temperature is reduced or it cools up, you can remove one by one the layers of towel that you coat it. And then the treatment time is about 20 to 30 minutes because it will only stay warm for 30 minutes or more. But of course, it will also depend on the room temperature. Probably if you are in Baguio or you are inside the room with an air conditioning unit that was set up too low, then of course it may cool up faster than 30 minutes. So, okay. The predominant effects of the hydrocollator packs would be increased blood flow as much as about 68% and returns to normal about 40 minutes. No? It has an analgesia effect. It promotes muscle relaxation and a temperature of about 43 degrees Celsius. Next, you have the electric heating pads. So compared to the hydrocollator packs, this one has 3 levels of intensity, so you can set it up manually, high, medium, or low. And the advantage is that the temperature is maintained throughout the use. But because of that, of course, there would be danger of burns, especially if you set it up at a very high temperature. Okay, so most that modalities are to be given, remember it would be about 20 to 30 minutes. Next, you have your paraffin bath. No, it's just like for ladies when you go to the spa and then you go for foot spa. Isn't it that at the end of your foot spa, they usually soak your feet in paraffin? No, it's just like a melted candle that coats your feet, and it provides a soothing effect on your feet, right? So this is the same paraffin bath. So it is the therapeutic application of a liquid paraffin to a body part for the production of heat. It contains a paraffin wax that is admixed with a mineral oil with a mixture of 6:1 or 7:1 ratio. So probably yung mga medtech sa inyo will ask, is it the same paraffin wax? Yes, in principle, they are the same paraffin, but the preparation is different. No? The paraffin that is used in the laboratory for your cell blocks are pure paraffin. No? It retains a higher temperature so that if you use that, it will surely burn the body part exposed to it, no? 'Di ba nung mga medtech tayo, pagka nabuhusan ka ng paraffin, nagbi-blister ka kaagad. Primarily because it will retain the heat more. But the paraffin wax that is used in the paraffin bath is actually admixed already with mineral oil. Sometimes they even put scents, no? Para pag may alipunga yung paa nyo at mabaho, no? Yung paraffin na ginamit maamoy ng konti, no? It melts at about 48 to 45 degrees, and it is normally self-sterilizing. It may be applied through several methods. So it could be by glove method. It means to say you soak your hands in the paraffin and it forms like a glove in your hand, no? Or it could be by dipping. So you put in several dips, or you can actually immerse your hand in the paraffin bath and let it stay there for about 10 to 15 minutes. Or you can also make use of a brush, parang yung paint brush, soak it in the paraffin, and then you brush it over the extremities like the digits of the finger. So it retains heat for a long period of time with tolerance for high temperature because of lack of danger of being burned. Because the specific heat of paraffin is 1/2 that of water. So since it's a melted paraffin, once it cools down, it forms an insulating coat over the skin. So the paraffin solidifies over the body structure. So temperature for using dipping or immersion techniques is about 52 to 54 degrees Celsius. And treatment time is about 15 to 20 minutes. So the indications would be in the use of painful joints due to arthritis or other inflammatory conditions in the subacute or chronic phase. So kaya painful joints in the hands or feet, because if you were to look at the structure of your hands and feet, it has irregular surface, no? So you cannot make use of the hydrocollator packs and wrap it around your finger, no? Because you have several fingers and it would be very thick to wrap hydrocollator packs on your fingers individually, but rather you can soak it in the paraffin bath. So it means to say this is being used for irregular surfaces such as the joint of your hands and your toes, no? So it is most often used wrists and hands. So contraindications would be allergic rash, such as if you are allergic to the melted paraffin, or it's like a melted candle. In the presence of open wounds, of course, di ba yung wound nyo, pagka nagkaroon ng skin disruption and you expose it to a high temperature, it is more painful as compared when you have an intact skin. Subukan mo kayang lagyan ng salt yung sugat, di ba? So mas masakit siya as compared to a skin that has not been disrupted, no? It is also contraindicated in the presence of a recent scar that has not yet matured and sutures, no? Or in the presence of skin infections, because we always, although it is self-sterilizing, you cannot really determine if a highly infected skin that was soaked in paraffin, if all the bacteria will actually will actually be sterilized, no? Because of course it also cools down, no? There are certain types of bacteria that are resistant to higher temperatures, and you may promote the transmission of these skin infections or any form of infections to another patient because of course we reuse the paraffin. Next, you have the superficial infrared ray lamp. So it is the therapeutic application of the radiant energy from the visible or the infrared portion of the electromagnetic spectrum, which is about between 7,700 to 150,000 angstrom. This is termed as the infrared. And superficial heating would be has a maximum penetration of about 3 millimeters. No? For the infrared lamp, you have to position it about 15 to 24 inches or 2 feet away from the structure that you want to heat up. Cover the eyes when exposing the face area. So the most common diseases or conditions making use of the infrared ray lamp would be facial neuropathy or Bell's palsy. But for this, you have to cover the eyes because it may dry up the cornea. So it is also used in certain dermatological conditions. No? So the infrared ray has different types. You have the luminous and the non-luminous. So the luminous contains the near infrared electromagnetic rays at 750 to 1,500. It penetrates the dermis and the subcutaneous tissue about 5 to 10 millimeter. And the non-luminous type contains the far infrared at 1,500 to 12,000. It penetrates the epidermis at about 2 millimeters deep. So again, treatment time. So most heating modalities, the maximum is about 30 minutes. No? So application would be you turn on the lamp, allow about 5 to 10 minutes for warm up. Reflector then is placed at right angle to the surface area. Patient should feel comfortably warm. So for this also, when you expose the lamp, they usually put a cover of about a hard paper that surrounds the infrared. Because you know, when you have a lamp, no, para siyang ilaw, of course, the beam of the light will be divergent, no? It reflects. So to give a uniform temperature or heat, you have to direct the lamp. You have to control the radiant heat. So you put a covering about 2 feet of hard paper and then surround the lamp. That will also maintain the distance of 2 feet from the lamp to the area that is being exposed. No? It will be to concentrate the heat to the area that you want to expose. Okay. Next, you have the hydrotherapy or the use of an agitated hot water or a whirlpool or a Hubbard tank. No, it's just like a small swimming pool or making use of a small tank. So feeling mo ikaw isa kang what do you call this? Parang fish, sirena, shokoy. You are exposed to the swimming pool and they agitate the water. It's just like a jacuzzi, no? So there are jets or stream of water that creates pressure, and when you expose the body part there, parang meron siyang massaging effect or soothing effect, no? So partial or total immersion baths in which the water is agitated and mixed with air to be directed against or around the affected part. And the heat is applied to all surfaces. At the same time, exercises could be done at the same time as exposing it to the high temperature. So you can perform the exercises because the buoyancy of the water permits better exercises of a weak or a painful extremity. So remember when you are submerged in water, 'di ba parang magfo-float ka actually, 'di ba? It is the buoyancy of water that will allow you partial weight bearing of a painful extremity, or if full weight bearing is not allowed, you can make use of hydrotherapy. So the whirling of the water has a massaging and a debridement action, no? So thereby it is beneficial for burns, open wound, and ulcers, no? Remember, when you have a burned patient or a burned skin, and then sometimes you put in ointment and then you cover it with gauze. Isn't it that when you remove the gauze or even band-aids, it is very painful, and sometimes a superficial layer of skin goes with the gauze, no? So exposing it to an agitated water or submerging it there, it gently sloughs off the bandage, including the dead skin. That is why it is very beneficial to treat burn patients with hydrotherapy. Aside from the massaging effect, it has the analgesic and sedative effect. So treatment temperature varies with the size of the area that is being treated. If you make use of the whirlpool, it's about 39 to 43 degrees because it has a wider surface or wider area compared to a tank, about 37 or 38 degrees Celsius. But in the presence of a peripheral vascular disease, the temperature should be at 35 to 43 degrees Celsius. Okay. So same treatment time. So this is usually indicated in the presence of decubitus ulcers, in the presence of open burns and wounds, post-hip fractures, because after surgery of hip fractures, they are usually put either on partial weight bearing or non-weight bearing. So you can do exercises when you are submerged in water because of the buoyancy of the water, no? So certain post-surgical conditions, subacute and chronic musculoskeletal conditions of the neck, the shoulders, and the back, and in cases of rheumatoid arthritis. Because in rheumatoid arthritis, you usually have symmetric multiple joints, all swollen and painful at the same time. So it is more cost efficient and it is more time efficient to submerge all the painful joints at the same time rather than treating them one by one. You can also have the aquatic or pool therapy. It is also a form of hydrotherapy, primarily for upright weight-bearing activities such as standing, ambulation, active exercise, both upper and lower extremity, or horizontal floating activities, with the same principle that because of the buoyancy of the water, it permits partial weight bearing of a weak and a painful extremity. No? It allows greater freedom and range of movement than is performed in whirlpools because you will have a greater area to exercise. No? So treatment temperature should be about 34 to 37 degrees Celsius. So the treatment time, of course, varies with the type of activity and the tolerance of the patient. Now, if the patient can tolerate being submerged in water for a longer period. So indications would be for those with poor standing balance, because you do not fear that they will fall or maslide sila, madulas. They will not have further injury because you are in the water. You can perform, so swimming is a form of an aerobic exercise. You can perform active assistive exercise in the pool, active exercise or resistive exercises dependent on patient capability. Contraindications, of course, if your patient has bowel or bladder incontinence. Why? I remember when I was in Baguio, I studied medicine in Baguio. And we have this favorite resort. Sa mga taga Baguio sa inyo, you're probably familiar in Asin Road, no? That is where the resorts with hot spring is located, no? So hot water. And then merong mga signage doon, nakakatuwa. Nakalagay sa signage, please don't urinate in the pool. You may drink it later. Okay? That's the reason why it is contraindicated to allow patients with bowel or bladder incontinence. No? Isipin mo, when you are swimming together with all the poo-poo, no? Hindi lang wiwi, poo-poo pa pala, no? Especially if they have urinary infections. Those with severe epilepsy, because they may have sudden seizure while they are in the pool, with unprotected open wounds because it may be infected and you can promote transmission to other people, with an unstable BP, severe cardiac or respiratory dysfunction. So these are contraindications to aquatic pool therapy. And of course, another would be if your therapists do not know how to swim and the patient themselves do not know how to swim, because both of you may drown in the swimming pool. Kaya sometimes yung PE ng mga therapists, physical therapists, would be in the first year would be a swimming lesson, no? Because they should know how to swim before they can treat patients in the pool. Next would be the UV ray, ultraviolet ray. So this is the therapeutic application of the radiant energy from the UV portion. So kanina is the infrared. This time is the UV or the ultraviolet portion of the electromagnetic spectrum. Mahal, nakikita ka sa aking video. Okay. So the part of the electromagnetic spectrum, 1.8 to 2,900 angstrom, that is considered the ultraviolet, no? And the most natural source is sunlight, no? You've probably heard your parents, no, when you go out in the sun, sabihin nila sa'yo, anak, hanggang 9 ka lang or 10, because after that, it is a dangerous heat, no? Yung sun, no? Dangerous na daw yung heat niya. It is ultraviolet, mainit masyado. It burns your skin, no? So, but there are superficial or clinical sources for the ultraviolet. You have your hot quartz mercury lamp. You have your carbon arc lamp, the cold quartz mercury lamp, and a sun lamp. So those is determined by testing it with the several methods. You have your minimal erythemal dose, a primary, secondary, or a tertiary erythemal dose. Parang sinabi mo ng first degree burn, second degree burn, third degree burn, no? Depending on the amount of heat. So the minimal erythemal dose is used to establish the therapeutic dose, no? Irradiation that is sufficient to cause a slight reddening within 6 to 8 hours, but it has to disappear within 24 hours with no desquamation. So there should be no blister formation. The primary or the first degree erythemal dose would be slightly greater reaction with a slight irritation, and there is a slight desquamation of the skin. The erythema may last up to 48 hours. Second or secondary would be a marked erythema, and there is already edema, peeling, itching, and a burning sensation with desquamation or sloughing off of your skin. The pigmentation now lasts as long as 72 hours. And the tertiary erythemal dose would be severe destructive reaction with edema, blisters, and exudation. So of course, the therapeutic dose that you want to target will be the first one, the minimal erythemal dose. So the UV ray, the penetration does not exceed 0.1 millimeter. The conjunctiva is sensitive, so eyes must be covered when being used. Isn't it when you're exposed to the sun? Anong una mong ginagawa? Tinatakpan mo yung mata mo, or you make use of si Ray-Ban, ang sikat na si Ray-Ban, because it is dangerous, or the eyes is sensitive to the UV ray, no? And there are certain drugs which now increases your sensitivity to the ultraviolet light, no? The use of the sulfa drugs, your tetracyclines, your anti-malarial quinine, even using coal and tar, no? So these drugs, when they are being used by the clients, the clients have an increased sensitivity to the ultraviolet light. But it also has a beneficial effect, the anti-rachitic effect, by converting now steroids to vitamin D. Kaya di ba tayo, ng mga bata tayo, our mothers would actually tell us to expose ourselves in morning light or sunlight until 9 or 10 a.m. because you want to target this effect, no? Converting steroids to vitamin D so that you will have stronger bones or mas mag-mature ang inyong bones, mas matibay. The peak bactericidal effect is at 2,600, wherein the UV destroys the bacteria by altering now the synthesis of the DNA and RNA. Kaya ginagamit din ito na sterilizing medium, no? So sometimes it is also used in hospitals to sterilize a large area. So sa room ko, pag umaalis ako, parang ano ko na rin to, disinfectant ko ng room parang after, because of the presence of this pandemic. So I usually schedule the UV ray after I go out. It automatically shuts off after 20 minutes. No? So it can sterilize the whole room. So it has desquamation effect. It sloughs off dead epidermal cells of the stratum corneum, and it may be used in certain dermatological conditions, such as acne, psoriasis, especially in the subacute and chronic. It is also used to sterilize mga infected decubitus ulcers or infected wounds. Okay. Contraindications would be, sabi natin, subacute and chronic, but you cannot use it in acute eczema or acute psoriasis, in generalized dermatitis, herpes simplex, in SLE, in xeroderma pigmentosa, because they have a hypersusceptibility to the ultraviolet light. Now we go to the deep heating modalities or the deep thermotherapy. No? For therapeutic purposes, diathermy is defined as deep heating, although this is now not commonly used. Wala nang masyadong gumagamit ng diathermies. Aside from the machine being expensive, it is also difficult to use. No? General indications, as all deep heating modalities would be, presence of joint contractures, musculoskeletal pain, the muscle pain, with subacute and chronic traumatic and certain inflammatory conditions. No? So general contraindications, so you cannot use it for acute infections, impaired circulation or sensation, and cognitive functions. Again, self-explanatory na yan. In the presence of malignancy, thoracic area which contains the pacemaker. Kasi sabi natin, this is deep, no? It penetrates muscles and tendons, no? So where your pacemaker can be located. So sabi natin, with increasing temperature, there is an increase in metabolism. It also can increase heart rate. So it may malfunction the pacemaker that is implanted. Okay. It cannot also be used for hemorrhagic diathesis because it will increase bleeding. It cannot be used in osteoporosis. Although, sabi natin kanina, yung UV, superficial yun, it has an anti-rachitic effect. But in the presence of an osteoporosis, the deep heating modality is contraindicated because it may also has a deleterious effect on yung mga immature, newly, parang new bone cells, no? It will destroy the new bone cells. It cannot also be used in growing bones. So yung mga children who has not completed their growth. Why? Because if the growth plates are heated up, it may destroy the growth plates. Of course, very young and very old, because they cannot actually tell you if it is too hot already. In pregnancy or the lower back during menstruation, because it of course will increase bleeding. Presence of surgical metal implants you cannot use most deep heating modalities because the metal will also be heated and it may burn surrounding structures. Next would be the ultrasound. This is the mostly used deep heating agent. It is most penetrating at 5 centimeters or more, and it is actually the only one that can reach the hip joint. It improves or increases deep tendon extensibility, and it is the only modality whose actual dose is measured or can be measured. Treatment intensity for ultrasound usually 0.5 to 1.5 watts per centimeter squared, depending on the treatment goal. So the ultrasound make use of high frequency acoustic energy. So sound waves, they are usually at frequency between 20 to 17,000 cycles per second. No, this is the sound or the waves that can be heard by the human ear. So comparing to ultrasound, the acoustic energy are higher in frequencies than this range. So hindi mo siya maririnig, no? It is faster than the sound waves, no? When applied on tissues, they cause mechanical vibration that will now dissipate heat. So when using ultrasound, you cannot actually feel heat, no, on the surface, but the heat will be felt in the deeper structures where you want to direct the high temperature. So the lower intensities would be for acute conditions or thin tissues, the wrist or the joint. No? So the higher the intensity, it will be used for deeper structures or thicker tissues. Lower intensities for more superficial body parts. Periosteal pain may occur during treatment due to a high intensity or momentary slowing or cessation of movement of the transducer head. So it's just like the diagnostic ultrasound where it makes use of transducer head, and you cannot put it steady. You have to move it constantly because the slowing movement, or if you become stagnant in a particular area, it can cause periosteal pain because of the continuous exposure to the high temperature. So treatment time is about 3 to 10 minutes. So I just put their average of 7 minutes per area, depending on the size of the area. So of course, if the area is bigger, the longer should be the duration. So contraindications, as most heating modalities, in acute inflammatory joint pathologies, if you have a healing fracture, because you may promote bleeding in the area of a healing fracture, in the presence of thrombophlebitis, with the use of radium or radioactive isotopes, and it cannot be used on other vital parts such as your brain, the ear, the eyes, in the epiphysis of growing bone, particularly at the growth plates, in over the heart, the cervical ganglia or the carotid sinuses, even on reproductive organs and the spinal cord, especially for post-laminectomy cases, because it may hit up the spinal cord and cause cord teetering. Okay, so indications in open wounds, presence of neuromas, or periarticular conditions with the following precautions. If there are metal implants on the field of application, in the presence of osteoporosis, ayan, kapag ang plastic mo orokan, baka matunaw, no? So, presence of plastic implants, over primary repair of tendons or ligaments or scar tissue. So, these areas should be avoided. So sometimes if the patient is post-laminectomy, if there is a complaint of back pain and you want to introduce ultrasound to the area, I usually instruct my therapists to avoid about 2 inches on both sides of the spine to prevent heating up the spinal cord. Another deep heating modality is the microwave. So parang yung ginagamit nating microwave, di ba? Pampainit ng pagkain. It's a heating modality. It makes use of high-frequency electromagnetic energy that is applied through a director. So hindi siya yung open box, tapos ipasok mo doon, tapos microwave, no? It makes use of an applicator with a frequency of 2,450 hertz. It is also part of the electromagnetic spectrum, no? And it penetrates up to 5 centimeter and is converted to heat in the body. So microwave energy reflected at fat, muscles, and muscle bone interfaces. Okay, another physical modality is termed as phonophoresis. It is the use of ultrasound to drive certain medications through the skin into the deeper tissues, no? So these are mga topical, it may be topical antibiotics, it may be a topical muscle relaxant or topical anti-inflammatory medications. If you want it to penetrate up to the muscles, then you can make use of ultrasound to drive the medications deeper into the body structure. So local analgesics and anti-inflammatory drugs are often used, such as your indomethacin, you have your ketoprofen gel. Treatment intensity is at 1 to 2 watts because, as I mentioned, the higher the intensity, the higher or the deeper will be the structure that it can penetrate. So treatment time is about 5 to 10 minutes. Lower intensities and longer time are more effective. So indications used in subacute and chronic musculoskeletal conditions. Another physical modality is laser. It is actually an acronym. It stands for light amplification, simulated emission of radiation therapy. So it helps reduce pain and inflammation, and it enhances tissue healing, both in hard and soft tissues of the body, including your muscles, the ligaments, and even bones. It increases oxygenation of tissues, and it will allow injured or damaged cells to absorb the photons of light, which will now speed up healing, no? So of course, because it also improves the blood circulation in the area, more nutrients are driven to the area to promote or speed up healing, no? Drives nutrients and oxygenation, improves oxygenation to the area. And it can be helpful for acute injuries such as in muscle strain or muscle sprain or even shoulder injuries, no? So remember, it can be used even in acute condition. So it is of two types. You have the low-level laser and a high-level laser. The low-level laser therapy is a pain-free, non-invasive. It is affordable tool used by physical therapists throughout the healing process that is becoming more prevalent now in PT practices nationwide. So they are the low-level or cold laser. When you say low-level, they are also cold laser. The high-level would be the hot laser. So the cold lasers are absorbed into the skin to increase cellular activity in tissues, which now can bring healing to the injured areas. So with increased cellular activity, you may also increase phagocytosis, or you can also attract the leukocytes there, which could also speed up healing process in an injury or injured tissues. So the laser is a monochromatic coherent beam which produces speckles of emission of high power density, which can cause a local heating or off in homogeneous tissues. So the laser therapy works now on the principle of photobiomodulation because parang it drives photonic energy, or it delivers this photonic energy in the tissue by laser, with the use of laser, which now brings about biological processes within the tissue. That is why it is termed as photobiomodulation. No? So these are the clinical effects of the laser therapy. So you can have here, wait. Can I zoom it? Okay, wala yata ako dito sa ano. So clinical effects, it increases angiogenesis and neovascularization. It will increase the collagen production. That is why it will improve the elasticity of tendons and joints. It increases, speeds up muscle regeneration and prevents muscle, or it reduces muscle atrophy. It will reduce inflammation and edema. That is why you can use it in acute conditions. It will increase nerve regeneration. It will increase the cartilage production, and it will promote new bone formation. So you can even use it for healing fractures, so acute conditions. So after the heat, you can now have cryotherapy or the application of a cold pack to treat acute conditions. So compared to the heating modality, the physiologic effects of the local cold application would be the following. So these are the body tissue responses to cold or exposure to a cold temperature. The skin temperature falls rapidly and exhibits greatest temperature change. The subcutaneous tissue temperature falls less rapidly, and it will display a smaller temperature change. Muscle and joint shows the least temperature change and should require a longer exposure. It will also result to vasoconstriction of skin capillaries, which result in blanching of the skin in the center of contact area. So remember, like when you are swimming in a cold temperature, isn't it that after exposure to the cold water in the swimming pool, you can see your skin para siyang prunes, nagpo-prune up siya. It is because of the vasoconstriction of your skin capillaries. So it may also induce hyperemia because of the exposure to cold temperature. There is a histamine reaction around the edge of contact area, even in normal tissue. Other effect would be cyclic constriction and dilatation of blood vessels following a prolonged cold exposure. It occurs mostly in apical areas such as your hands, the face, the ears, and the feet, where arteriovenous anastomosis are found in the skin. So di ba pagka you are in the cold areas, yung mga taga Baguio dyan, isn't it that, or you go to countries na nag-snow, what do you see these people use, di ba? They put on mga foot warmer, leg warmer, they put in gloves, they have muffles and covers the face, the ears, no? Because they are more susceptible to experience the cold temperature, no? So it also has adverse effects. You can encounter people with hypersensitivity resulting to cold urticaria, wherein there is erythema of the skin with wheal formation associated with severe itching due to the histamine reaction. You can have facial flush or puffiness of eyelids, or even respiratory problems such as yung mga may asthma, and in severe cases, anaphylaxis, wherein there is a decrease in the BP and increase in the heart rate, sometimes with syncope, also related to the release of histamine. So general indications would be, you can use it for both acute and chronic traumatic inflammatory conditions. You can use it in the presence of edema, no? Because of the vasoconstrictive effect. It can also be used to relax a spastic muscle. It has a sedative effect for musculoskeletal pain. It is also beneficial for thermal burns. General contraindications would be impaired circulation, because with increased vasoconstriction, again, there would be lesser blood supply. Impaired sensation, you can also have a burning sensation secondary to is extremely cold exposure. Di ba yung nagkakaroon ng mga frostbite? In the presence of peripheral vascular disease, you will further decrease the blood supply. Prolonged application over superficial nerves can also result to neuropraxia. Kaya nga sometimes when you do injections, di ba? You expose the area to the cold, to ice pack, and because the effect that yung numbing effect niya or parang analgesic effect niya is because of neuropraxia. So parang there is a temporary damage to the nerve so that it will not transmit the pain signal. It can also be contraindicated in the presence of Raynaud's syndrome, sensitivity or allergic reaction to cold. So the initial effect of exposure to a cold temperature would be vasoconstriction, which leads to an initial diminished blood flow. But after removing the cold temperature or the cold modality, there will be a reflex vasodilatation. So it can be done every 30 minutes, lasting about 15 to 30 minutes. Anesthetic and analgesic effect is due to slowing of the nerve conduction and also affect cold receptors of the skin. It also promotes relaxation and a decrease in the metabolic rate. So these are the available, so there are certain available cooling physical agents, but some people could not tolerate cold, but they can actually tolerate heat. So sometimes there are people who prefers the heating modalities, no? But these cooling physical agents are used for acute forms of injury, results to vasoconstriction, which lessens edema formation. So commercially available cold packs is the same as the hydrocollator packs that is used for superficial heat. So instead of exposing it to boiling water for superficial heat, you now put it inside your freezer so that the silica gel, which is hygroscopic or water-loving, will retain the cold temperature. Okay. So the vinyl casing filled with silica gel, it is also the same vinyl casing filled with silica gel or a sand slurry mixture. So treatment temperature, the packs maintained, if the packs are maintained refrigerated at 0 to 10 degrees Fahrenheit, duration of about 10 to 20 minutes. It should not be applied more than 20 minutes because you may also promote gangrene because of the severe reduction in blood supply in the exposed area. After 20 minutes, there will be a reflex vasodilatation, which may result to further edema formation. So maintain it less than 20 minutes. No? You may reapply it again after 60 minutes. The most simple form of the cold or cryotherapy would be ice packs. So you can make use of actually yung mga ginagawa nyong ice sa ref or the ice cubes. Or you can crush the ice and then surround it with a moist towel, or you can put it in a plastic bag covered by moist towel. And then you can use it already as cold packs. So treatment time, 10 to 20 minutes. Or you can also use an ice cylinder formed by freezing water in a container. So yung tank depressor nyo, you can put water in a cup, put in the tank depressor, put it in the freezer. And then you can have yung parang ice drop. And you can use that to treat certain areas. Like in dysphagia management or swallowing therapy, you can make use of the ice cylinder to stimulate the pharyngeal or oropharyngeal muscles in preparation for swallowing exercises. No? So during application, patient experiences the following physiologic responses. Of course, the cold temperature. If prolonged duration may lead to a burning sensation, sometimes aching because it disrupts the impulse transmission in the nerve because of the resulting neuropraxia. And of course, because of the neuropraxia, you can also have numbness. Okay, you can also use it for massaging. So ice massage, apply ice massage to an area not larger than 4 by 6 inches in a slow movement, overlapping circles or overlapping longitudinal strokes. Each stroke should cover at least 1/2 of the previous circle or stroke. Do not massage over bony areas such as your elbow. Why? Because you have your ulnar nerve superficial in the condyle, or along your fibula because you have your peroneal nerve that is anchored along your fibular head. You may induce neuropraxia over these superficial nerves. So continue the treatment until anesthesia is achieved. Treatment time is about 5 to 10 minutes. Another form of a cooling agent is the vapocoolant spray. So para siyang hairspray, you spray it in the area. It maintains the area relatively cool for a few seconds until such time that you can perform what you want to perform there. Like you can spray, try to stretch or massage, or like when you do injections, you can spray and then you can inject after spraying because the area is already numb, no? So it is a non-toxic, non-inflammable volatile liquid which produces a rapid cooling when a fine spray is applied to the skin. It is primarily used to reduce muscle spasm and to desensitize trigger points. But the use is being questioned due to the chlorofluorocarbon ingredients within it because of its possible bad effect to the environment. But the use is common in sports medicine. Example, basketball. Sabi ni Jaworski, last 30 seconds. Kaso si Jaworski Jr. na injure. Kailangan niya mag-play. Lahat sila, very common sa team ni Jaworski lagi, Hinebra, lagi silang out. Lagi silang strike out, no? Pagka wala na silang athlete, tapos injured pa. Yan, pwede nilang gamitin ngayon yung spray and can play a few minutes more because of the analgesia effect. Kaya common siya sa sports medicine. But because of the chlorofluorocarbon, medyo hindi masyadong nagagamit, no? Bad effect to the ozone layer. Okay, next. Physical modality is the contrast bath. So contrast because it makes use of contrasting temperature. It could be a sequence of cold, hot, cold. The start and the end will be determined by your goal. So it is the alternating immersion of a body part in a warm and a cold water to produce vascular exercise through active vasodilatation and vasoconstriction of blood vessels. So usually they begin with warm water. So you have vasodilatation. So place part in warm water for about 6 to 10 minutes and then transfer to cold water for 1 minute and then immerse again in warm water for 4 minutes. Continue the sequence about 4:1 ratio. So end in warm water or depending on gusto mo ba ng vasoconstriction end or vasodilatation end. So the condition treated may determine the ending temperature. So ending in cold may be more beneficial when you are treating edema because you want vasoconstriction. So hot water, the temperature should be about 100 to 110 degrees Fahrenheit. You may convert it to Celsius if you're more familiar with degrees Celsius. And the cold water would be about 55 to 65 degrees Fahrenheit. So you just convert it, 1 degree Celsius is about 32 degrees Fahrenheit. So treatment time for a conscious bath is about duration of 20 to 30 minutes for both hot and cold. So any condition requiring stimulation of peripheral circulation in limbs would be the indication. Another would be peripheral vascular disease, sprains or strains, and a few hours after trauma. Why? Because you want to control the swelling. Contraindications would be in the presence of advanced arteriosclerosis, in the presence of decreased sensation to both the heat and the cold. Okay. Another physical modality would be therapeutic massage. No? This is defined as manipulation of the soft tissue with the use of the hands. Kaya minsan, tawag nila sa therapists, binabasa nila, the rapist, because they make use of their hands. No? Ginagalaw nila yung body parts, no? Para silang rapists. But they are not masseurs. It is the manipulation of the soft tissue has its therapeutic effect. So techniques used could either be stroking technique or effleurage. You also have the kneading technique, or termed as pétrissage. You have the friction massage, you have tapping, and the vibration. So, syempre, stroking. Meron kang technique pag nagpapamasahe ka, di ba? Kneading, if you want to remove the muscle nodules, no? Or friction, no? Parang i-grasp mo yung muscles. Tapping, di ba? When you do pulmophysiotherapy, you want to drive secretions, you cup your fingers and you do tapping technique. Okay, physiologic effects of massage would be to diminish congestion and edema. So in the presence of edema, you can actually do massage to drive fluids from distal going to the periphery. So increase lymphatic and venous flow, mechanical stretching of tissues, and it will retard myotatic contractures. It will also relax and also has sedative effects, thereby reducing pain. But it does not improve the muscle strength or significantly increase arterial blood flow. So these are the following are the indications for massage. You have subacute and chronic pain in the presence of muscle spasm, for superficial scar formation, such as in trauma or burns, in the presence of edema, so driving fluids from distal going proximal, and for postural drainage, no? Particularly for pulmonary secretions. No? Contraindications would be presence of local infections and malignancies, because you may transfer it from one body part to another. Another modality would be the use of an intermittent compression unit, or it is termed as the Jobs compression unit. So it makes use of a sleeve that is inflated to create pressure. So commonly used would be on the upper and the lower extremities, particularly in the presence of edema. So it is a vasopneumatic device that applies external pressure to an extremity through an inflatable appliance or sleeve. The external pressure on the extremity increases the pressure in the interstitial fluid, which forces now the fluid to move into the lymphatic and the venous system, thus reducing the fluid volume in the extremity. So driving the fluid from distal going to the proximal to go into the lymphatic and the venous system to drain excess fluid in the limbs. So method of application would be elevate the limb about 45 degrees and then abduct it to about 20 to 70 degrees with the appliance used over the extremity, and then set an inflation and deflation ratio to 3:1. Then increase the pressure to the desired level. The pressure should not exceed the diastolic blood pressure, with pressure in the distal compartment greater than the proximal. Why? Because you want to drive the fluid from distal going proximal. So greater pressure in distal so that there will be no resistance in the distal part of the body part or extremity. So numbness, tingling, pulse, or pain should not be felt by the patient during treatment because if this is felt, it means that nerves in that particular area were also compressed. It may result to neuropraxia. So treatment time, 20 to 30 minutes for traumatic edema, 2 to 8 hours for lymph edema. So usually ito na yung mga may parasitic infections, no, that causes lymphangitis or lymphedema. So indications in amputation, if you want to have a good stamp for measuring or prescribing your prosthesis, you want the stamp to be in perfect shape with no edema. In the presence of arterial insufficiency for intermittent claudication because of the external pressure, in the presence of chronic edema or lymph edema, post-mastectomy, you know that in post-mastectomy, they usually also remove lymph nodes, now several layers of lymph nodes. And in the absence of lymph nodes, lymphatic drainage is low, sometimes absent. That is why sometimes you cannot drain the excess fluid in the upper extremity. So you can make use of the compression unit to remove the excess edema. It can also be used for stasis ulcer and venous insufficiency. So contraindications, presence of acute inflammation, acute DVT, pulmonary edema, because you may further drown the lungs with so many fluids that you are taking from the extremities going to the lungs, no? In the presence of diminished skin sensation, because the external pressure brought upon by the sleeve can also cause skin breakdown. Edema in patients with kidney or cardiac insufficiency, you may drive the patient into congestive heart failure with excess fluid. In hypertension, because compressing also the vascular structure may lead to further increase in BP. Impaired cognitive function, infection in the area, in obstructed lymph nodes in the very young and the very old patients. So these are all contraindications. So next would be electrotherapy. General indications of electrical stimulation would be pain modulation. It works on the principle that it will block the pain signals. With electrical stimulation, the voltage-gated channel of transmitting the pain signals will be blocked, resulting to pain modulation. It is also indicated for muscle spasm. In impaired range of motion probably active because of the weakness. So the electrical stimulation will promote contraction of the muscles, which will increase the movement of a particular joint, thereby increasing range of motion. It can also be used for muscle re-education or training muscles to respond appropriately to volitional effort. In disuse atrophy, so sometimes when you have limbs that are already denervated, muscles that are not actively moving will go into atrophy. It can also be indicated for soft tissue repair because the electrical stimulation will also promote increased vascularity in the area. So it will improve oxygenation and improve the nutrients or nutrition in the particular area. It can also be used for edema reduction. So we put the electrodes and then wrap the limbs in an elastic bandage, then elevate the limbs and you put on the electrical stimulation, which will promote contraction of the muscles. So the contraction of the muscles will improve lymphatic drainage, thereby reducing edema in the area. It is termed as Faradism under pressure, or FUP. Of muscles which are already denervated or with impaired nerve function. So general contraindications, it should not be placed over healing fractures while, because sabi natin, it will promote contracture of the muscles. So it will induce movement in a particular joint. So if the fracture ends are not stable, it will promote greater movements. No? So that the great movement, gross movement in fracture ends will lead to a non-healing fracture. It should not also be used in areas of active bleeding. It will increase the bleeding. In malignancies or phlebitis, it is not also used on superficial metal implants, pharyngeal or the laryngeal muscles, because if your pharynx or larynx goes into spasm, the patient may choke up or will not be able to breathe properly. And of course, it cannot be used over pacemaker, as it may speed up the setting of the pacemaker. So the functional electrical stimulation is just like electrical stimulation. The difference is that you place the electrodes over a particular muscle with a particular function. Like for example, you can put the electrodes along all flexors first, and then you tell the patient that when they feel the contraction of the flexor muscles, then they should do active flexion of the joint. So you are promoting the function of the particular muscles. That is why it is termed as functional electrical stimulation. It is used for disuse atrophy with impaired range of motion, in muscle spasm or muscle re-education, and spasticity management. Because you are promoting movement in a particular joint, thereby reducing volitional spasticity, no? Because you are instructing the patient to do a particular function. It is also called neuromuscular stimulation, because you are actually stimulating the nerves also in the muscle. It can also be used as an alternative supplement to the use of certain orthotics. So parang ito rin yung ginagamit ng mga robotics, no? You've probably seen on YouTube yung mga parang robots or robots na nilalagay nila over extremities. So after that, the patient will be able to move a particular parang yung sa prosthetics na your artificial limb, di ba? It makes use of electrical stimulation to promote movement of the orthotics. So it is an alternative supplement. So treatment time is about 20 to 30 minutes. It can also be used in a biofeedback therapy program. So paano yung biofeedback? So it gives a feedback to the patient that there is contraction of the muscles, and you can ask the patient or encourage the patient to do a particular movement, or with electrical stimulation of the muscle, you can do EMG and CV, wherein needles are placed on the muscle, particular muscle, and then you put the electrodes. The electrodes now will do electrical stimulation. It will contract the muscle, and the contraction of the muscle now will be documented on a screen, which creates certain waves and a certain sound. So biofeedback, you can instruct your clients, when you hear the contraction or the sound, try to relax the muscle, no, to reduce spasticity. That is a form of a biofeedback therapy program. And of course, the electrical stimulation, because of the external contraction of the muscle, it will also retard muscle atrophy from disuse. Okay. Next, you have the transcutaneous nerve stimulator. So the machine that is used for electrical stimulation, functional electrical stimulation, or neuromuscular electrical stimulation is the same machine for transcutaneous nerve stimulator. No? It is also a pain modulator for both acute and chronic, making use of electrode and placing it along the nerve fiber, which will now stimulate the C fibers of the nerve to control the pain pattern or the pain cycle. Now, with the stimulation of the C fibers, it will decrease the transmission of the pain signals from the periphery to the brain, thereby modulating pain signals. No? It is very effective, treatment time of about 20 to 30 minutes. So you can use it simultaneously with your hot packs or cold packs to para maging time mas less time consuming. It should not be applied to mucosal membrane, the eyes, the larynx, or the pharyngeal muscles, even the head and the neck. So compared to phonophoresis, you also have iontophoresis with the same goal of driving certain medications to certain body parts or muscles. No? So compared to ultrasound, the iontophoresis will make use of a continuous direct current. Sa phonophoresis, di ba, it makes use of the acoustic energy to drive the medication. In here, you use the direct current to transfer medicinal agents through the skin or the mucous membranes for therapeutic purposes. Okay. The next modality is the shockwave therapy. It is also synonymous to the term extracorporeal shockwave. When you say extracorporeal, the shockwave is produced outside the body, extracorporeal. So it makes use of a short, intense energy that is produced outside the body, and it is directed over the body part, and it crosses the fat body muscle surface. So in the beginning, the extracorporeal shock wave was initially used to break down kidney stones or to disintegrate kidney stones. So you've probably heard shock wave for kidney stones. But the use has been explored to disintegrate other stones in other body parts, such as your liver stones, gallbladder stones, even bile duct stones, salivary stones, kidney stones, pancreatic stones, and urethral stones. So the medicinal use of this was initially utilized, focused on breaking up these several stones in the body. But after its continuous year, researchers have found out that there are also certain muscle pains or body aches that has been resolved with the use of the shock wave. So now they tried to explore possible uses of this shock wave aside from disintegrating certain bad stones. No? So this shock wave is actually an acoustic wave which carries with it high energy to painful spot to provoke healing and repair process. So, in short, parang yung isang body part, pag sinugat mo siya, sabi niya, faster ang healing process, no? As compared to you have a painful area with a decreased speed of healing. But if you try to injure that particular area, the signal for healing process is more intense, no? So parang you introduce a certain injury to the area to promote healing process. So parang ganun yung principle ng shock wave, no? Because if you try to see how it is being used, it looks like parang jackhammer yung ginagamit para sirain yung mga kalsada natin, yung mga semento sa kalsada. So para nilang gina-jackhammer, they focus certain vibration in that area to break up the stone. So ganun din yung sa muscles, parang the energy is directed over certain spots to try to break up certain body nodules, which may be the result of, which may result to the formation of yung pain signals, no? So main fields of application you have in orthopedics, in rehab, even in sports medicine for certain calcific tendinitis, in others such as aesthetics, in urology for breaking kidney stones, even in dermatology. And the most common applications would be in shoulder tendinitis from calcific bicipital tendinitis or supraspinatus tendinitis with achilodynia or in the heel pain or heel spur or calcaneal spur or yung mga plantar fasciitis. So these are just several terms that are synonymously interchanged for using shock wave. So you have the low energy shock wave, the radial shock wave, the pressure pulse therapy or acoustic wave, all refer to one therapy that is defined by the shape of the pulse, no? So it is prescribed with energy about 1 to 5 bar, wherein 1 bar is equivalent to 0.15 millijoules per millimeter square of energy flux density. So that is the intensity of the energy that is directed on a particular spot to create certain shock waves penetrating the body interface. So how does it work? So you have here, para siyang gun, it has a projectile which compresses the air. So parang gun, kapag inano mo na siya, trigger mo siya, di ba, the bullet is thrown forward, propelled forward. So in here, the compressed air is propelled towards the transmitter, directed over the body, over fat and muscle. So the projectile accumulates a quantity of energy in joules, depending on the square of speed, and then it transmits the compressed air, creating several shock wave in the area. So it breaks down the barrier, whatever was the painful spot, whatever creates the painful spot. Is it a calcified tendon? Is it a muscle nodule? So it breaks it down, which may result to the relief of pain. So biological effects with the use of shockwave are the following. So you can, it can activate certain cell types such as the pericytes, which will promote neovascularization. It activates the osteoblast for osteogenesis, the fibroblast for collagen production, and it is supported by vasodilatation. So with all of this, it promotes healing and promotes or improve extensibility in your muscles and tendon. So the effects, other effects will be stimulation of osteoblasts, again, increases osteogenesis, collagen by fibroblasts to accelerate the healing process. So other effects in other body tissues, commonly research area. So in this X-ray compared to this, you can see here a hyperechoic area. It is actually a calcified bicipital tendon, resulting to bicipital tendinitis. After about several episodes of shockwave, you can see that the calcified area has been disintegrated, no? So it was proven effective in 70% cases of shoulder tendinitis. So this was a patient before treatment with a very limited range. After 3 shockwave sessions at an energy of 1,500 shocks or pulses at 3 bars per session, you have a significant improvement in the range of the shoulder joint. Okay, other effects, pain relief, you can have muscle relaxation, local microcirculation increase, healing process, or it enhances or speeds up healing. Okay, so increase microcirculation. That is why there are certain contraindications, because it may also promote bleeding, no? Most frequent indications would be trigger point treatments, frozen shoulder, Cox arthrosis or gone arthrosis, arthrosis of small finger joints in muscle spasticity, acupuncture point stimulation, or even over scars, no, to prevent hypertrophic scarring. So contraindications because of yung sabi ko kanina, it will increase microcirculation, so it may promote bleeding. So it is also a contraindication if you have bleeding tendencies or patient is taking certain medications that may prevent coagulation of blood, so that bleeding will be enhanced. Other relative contraindication we have in the presence of skin defects. So it is a relative contraindication. Some studies shows actually improvement, such as in diabetic ulcers. In the presence of tumor, fever, flu, or other infectious diseases, in areas of the varices because it may increase bleeding or promote bleeding of varices. It should not be applied just above the nerve because it may induce neuropraxia. It should application in certain areas such as the eyes, the periorbital area, the myocardium, the spine, gonads and kidneys and livers are contraindicated. And sabi ko nga, bleeding, particularly for those with corticosteroid use within 6 weeks. So after a corticosteroid injection, do not do or prescribe shockwave because it may result to bleeding. It is also contraindicated in sensational deficit in the treatment area in the presence of disc hernia or protrusion. Absolute contraindication would be in blood coagulation disorders because of possible bleeding or patient on anticoagulation treatment, those with mga aspirin. It is also contraindicated absolutely for pregnant patients, abdominal or frontal pelvic application. Okay, I think this will be the last modality, the use of a tilt table. So it's just like a bed, with a mechanical bed, wherein you can at certain degrees, you can gradually tilt it. Kaya siya tinawag na tilt table, from a supine to an upright position, with the patient on bed and strapped to the bed so that the patient will not fall down. You can gradually tilt it, no? Mechanical or electrical table designed to elevate patient from a 0 horizontal to a 90 degrees vertical position in an incremental manner. So why incremental? Because you would like to stimulate a cardiovascular response to positioning. So placing the patient in prolonged bed rest will lead to postural hypotension, especially if you immediately stand up the patient. So doing it in incremental manner and gradually customizing the patient to the increase in tilt will promote a slow adaptation to the cardiovascular response, to the change in position. So you can prescribe the tilt table for patients who were chronically flat on bed to reduce chances of postural hypotension. So, and also the beneficial effects would be the gravitational effect of standing. It can prevent osteoporosis. It could also lessen the incidence of constipation or UTI. Isn't it that from sleeping in a supine position, when you wake up, your intestines by gravity will be there will be increased movement, no? So when you stand up a patient from a prolonged bed rest, you can stimulate movement of your intestines to lessen possible constipation, no? Of course, hypostatic pneumonia, because you can promote the movement of the pulmonary secretions. No? They are indicated for patients on prolonged bed rest, immobilization, in a spinal cord injury, particularly in the cervical area, or a head injury, so that you can stand up the patient, or you can also give the patient of a feeling that he is able to stand up or being in an upright position. Oh, we have ito na pala yung last, therapeutic exercise. No? It is the prescription of bodily movement to improve a certain disability or to maintain a state of well-being. The goals would be preserve or improve the range of motion, increase strength in a selected muscle, improve cardiopulmonary endurance or improve muscle endurance to exercise, reverse or prevent the effects of deconditioning of those with prolonged bed rest, and to improve the coordination of a client. No? So goals: improve function, relax tense muscles, and for muscle re-education. So exercises can be classified as passive if it is another person doing the exercise for a client. No? It is not the client who does the exercise. Active, it is done actively by the patient. Active resistive, the active action is done by the patient, but there is a resistance or there is an assistance from another person. No? Resistive, if resistance is applied either by a machine or another person. And then you can also have stretching exercises. You want to go beyond the allowable range of or available range of a particular joint. You stretch it beyond it. It could also be a re-education type of exercise, like a person who has been prolonged on bed, suddenly when they stand up, parang hindi na sila marunong tumayo, maglakad. So that is why re-education, improving the coordination and balance, or even relaxation exercises. Okay, so that's my last slide. Sana nga nakikinig kayo. If you're listening, thank you. Do you have any questions at this point? Any questions?
And so far po ata to.
Okay, sige. Let me just take